what's some of the current evidence supporting the use of things like vitamin E or other antioxidants in non-diabetic MASH patients?
Yeah, like in many medical conditions, we think oxidation issues might be the cause of some of the bad outcomes that patients have with very many diseases. And it's true with the liver too. And one of the antioxidants that has some efficacy and is readily available and isn't very expensive is vitamin E. And there was a study in fatty liver and what we then called NASH, but is now called MASH, in non-diabetics called the PIVENS trial, PIVENS, and the NS part was NASH and the VE part was vitamin E. So vitamin E was looked at in a placebo-controlled trial in NASH in non-diabetics and non-cirrhotics too, by the way. And it did have some efficacy. Um, and vitamin E in the recommendations is listed as something to consider in a non-diabetic, non-cirrhotic NASH patient because it did help short-term outcomes. But many physicians don't really use that anymore, I would say. Uh, so there may be some role in selected patients
Yeah.
with MASH.
What is the most significant source of oxidative stress in MASH patients, and how can that be mitigated?
Yeah, that's a great question too. Again, in my understanding of the literature, very poorly understood. What are the drivers of oxidative stress? That's the term we use. Again, for many diseases, fatty liver is one, that we think is critical for the development of true damage in the liver. Because, of course, if you could identify those drivers of oxidative stress, you would eliminate them if you could, and you would also develop therapies to combat them. But not great understanding yet of the drivers of oxidative stress that cause damage in the liver. Again, maybe 10 years from now, we will have some better understanding, but not yet.
I want to round out just talking about your direct communication with patients. How do you explain kind of the difference between the they're both pretty bad of fatty liver and then the more advanced stages? How do you explain the differences between these two things to patients, and what are you finding is kind of the biggest hurdle when it comes to getting patients to understand where they are at with their health?
That also is a great question. One of the many factors that I think impact the relationship between a doctor and a patient and their outcomes uh, is the communication that a doctor or any provider has with the patient. When patients come to see me or come to see any provider, I always say they want to know four things,
Mhm.
all of them. I don't care what provider. You want to know what you have, you want to know why you have it, you want to know how bad it is, and you want to know how to fix it. And maybe a fifth is how are you going to follow me over time? Those are the things you want to know. So I spend a significant amount of time talking about, like I just did on this podcast, talking about what this actually is, this problem. And I talk to them about why they have it, the factors that lead to it. I then tell them we need to figure out if you have fibrosis, which is damage in the liver or not, because that will help me with your prognosis. And then I tell them how to fix it, which is usually weight loss, abstaining from alcohol, treatment of type 2 diabetes mellitus if they have it, and treatment of their cholesterol triglyceride problems if they have it. And I do that with every patient. And I think it really helps them. It makes them more comfortable because they understand the problem, and it makes them more comfortable because they know what they need to do about it. And it makes them more comfortable because they know how I'm going to follow them. When you read the internet now, which everybody does, patients and doctors and providers too, as a matter of fact, a lot of the stuff on the internet about medical diseases is bad. People that are doing great with medical diseases usually are not on the internet writing testimonials. The people that are on the internet writing testimonials are people who are doing poorly. So patients, in my experience, who have a disease like fatty liver, when they read the internet, they get a very kind of a biased look as to what is going to happen to them. And I try to correct that. And it usually makes them feel much more at ease and much happier and much more secure and much more confident. And I tell them that we have a chance to actually reverse this, fix this, and that the long term outcome can be very good.